The tiny 81 milligram of aspirin may protect your heart, but the 325 milligram dose may protect you from the wrong problem. Aspirin is not a vitamin, it's a blood thinning medicine. One aspirin dose can save lives in right person and cause bleeding in the wrong person. Hello everybody, I'm Dr. PK, a board certified internist practicing in California for more than 30 years. My videos are for educational purpose only. Many people take aspirin every day because they think it is a heart safety net. But here is the important question. Are you taking aspirin because you truly need it, or just because someone told you years ago that it was a good thing for your heart? Because today medicine has changed. It's not same as many years ago. There's a big difference between 81 milligram of aspirin and 325 milligram full strength aspirin. And taking the wrong dose can increase the risk of stomach bleeding, brain bleeding, ulcer, bruising, especially in older adults and people taking blood thinners. You won't believe 30 years out of the 30s of my practice, 25 years I did work in a hospital. And I seen many cases who had come to ER for internal bleeding, and most of them were taking blood thinner, and majority of them were taking aspirin, and that too was related to elderly folks. So I'm going to discuss how aspirin works. Think of platelet as tiny, sticky repair cells in your blood. When you cut your finger, platelets stick together, stop bleeding. That's good. But when plaque ruptures inside heart artery, platelets can form a clot, and clot can cause heart attack and a stroke. And aspirin reduces platelet stickiness. Aspirin does not clean your artery. It makes your blood less likely to form dangerous clots. 81 milligram aspirin dose is usually enough to block platelet activity for heart protection in people who already have cardiovascular disease. And this is called secondary prevention. This means you already had heart attack, stroke, TIA, coronary stent, bypass surgery, and known significant arterial disease like bypass surgery in your legs, aortopopliteal or femoropopliteal bypass. For many of these patients, 81 milligram daily is commonly used because it gives antiplatelet benefit with less bleeding concern than the higher dose aspirin. The adaptable trial found that 325 milligram was not superior to 81 milligram for patients with established cardiovascular disease, but at the same time it increased the risk of bleeding. So recommendation has changed. For secondary prevention, you need 81 milligram of aspirin. When do you need 325 milligram of aspirin? 325 milligram dose is usually not used routinely every day for most long-term heart protection. It may be used in a specific situation like suspected heart attack under medical direction. So suppose somebody is having very suspicious chest pain, giving one dose of aspirin sounds like a good idea. Or somebody we know in the emergency room, they're having heart attack, they're going to get 325 milligram. 224 American Heart Association and Red Cross first aid guidance says adults with non-rheumatic chest pain should activate EMS and be given 162 to 325 milligram of aspirin while waiting, unless somebody is allergic or have been previously told that they are allergic to aspirin. So for daily prevention, more aspirin does not mean protection. It may simply mean more bleeding risk. Who should not start aspirin casually? This is the part many people miss. If you never had a heart attack, stroke, stent, or known arterial disease, aspirin may not be helpful. For primary prevention, the USPSTF recommends individualized decision making for adults 40 to 59 years at higher cardiovascular risk, and recommends against starting aspirin routinely at age 60 or older to prevent a first heart attack or stroke. Think about that. But I see patients still who are on aspirin, they have no such history because they have known all of their life. Somebody has told them that taking a baby aspirin is a good idea. So aspirin should not be started just because my cholesterol is high, just because my father had a heart attack, just because I want to be safe, just because somebody told me, just because I saw it online. You need a personalized risk review. That means blood pressure, diabetes, LDL, ApoB, lipoprotein, smoking history, kidney disease, history, ulceration, other blood thinners. This is the real secret. Aspirin prevents clot. It does not treat cholesterol, inflammation, insulin resistance, plaque buildup directly. So if your ApoB, LDL, triglyceride, blood pressure, blood sugar are controlled, aspirin alone is not enough. You need a full heart risk audit. So remember, 81 milligram aspirin is commonly used for long-term protection in people with known cardiovascular disease. 325 milligram is only reserved for a specific acute situation like impending heart attack or special physician directed reasons. And if you are taking aspirin just in case, please talk to your doctor before continuing. It's not a good idea. Watch my heart medicine playlist on YouTube where I explain statin, ApoB, and lipoprotein A, blood thinners, and how heart attack really happen. Don't guess with your heart health. Learn it, measure it, treat it correctly. Let nature help heal you. I'm Dr. PK from Dr. PK Live. Thank you for watching. Have a great weekend.